Welcome, everyone. I'm Dr. Hamwi, and today we're going to be doing a little bit of a seminar sort of style. I guess it's more of a conversation with Jill and I. We're calling this the Awake Arm Lift Jill's Journey, all right? So Jill is someone who's very special to me. She's actually one of the employees at our practice, and she underwent a brachioplasty, about 4 months ago. And so here we have someone who has firsthand knowledge. Not only is she someone who has been through this before, but she's also on the medical side of it and delivered, care to patients before, during, and after the procedure. And so she's got some really great insight. And I thought that what we would do here is spend a little time letting her tell her story, and then me giving maybe the doctor's perspective. One second. So what we're going to do here today is I'm going to kind of introduce myself and Jill. She's going to talk a little bit about her weight loss story, and then we're going to talk about each of the steps that led us to her sort of where she is now. The preoperative process, the surgical process, post-op, what that was like, and then that recovery timeline afterwards. And then we'll talk a little bit just about arm lifts, and just things that maybe don't just pertain to Jill, but pertain to anyone who might be considering this. And then at the very end, we can kind of open it up for some questions. So first, a little bit about me. I'm Dr. Hamwi. I'm a board-certified plastic surgeon. I did most of my training on the East Coast. I'm from Ohio originally. Did some of my training in the Midwest as well. And then ultimately, my wife is from here in Sarasota, which is what brought me back here. I love it. Sarasota is a beautiful little beach kind of town community that's actually growing tremendously into something much more than that. But it's kind of a nice spot, not only to raise a family, but also to have a practice. And when patients come into town, we've got a nice little airport that's pretty convenient, and things of that nature that make coming to Sarasota and having the brachioplasty something that is relatively easy to accommodate. So, a little bit about Jill. I'll let her kind of jump in now.
Yeah, so my name is Jill. I'm one of Dr. Hamwi's surgical assistants, so I work with him in the operating room. I was born and raised in Connecticut, and around August or September of last year, 2024, it's been over a year now. I moved down to Florida. In October of 2024, I started working with Dr. Hamwi, and I kind of saw the behind the scenes of the brachioplasty, and I really just love being mentored by Dr. Hamwi. I aspire to work in medicine, potentially become a PA or a doctor one day, and working alongside him, I truly see what skill and expertise looks like, and our team is great. I really get to watch our patients grow from when they first call in, they're a little nervous. I walk them through the consultation process, and then I help them through the operating room, and then we get to see them at 2, 4, 6 weeks post-op. It's wonderful.
Yeah, it's kind of fun watching them. You talk about gaining confidence or seeing their results kind of develop, and this is one of my favorite things to do. It is. It's special. I think that arms can be very powerful in regards to helping people feel their best and sort of come out of that shell. And this is one of the things that you experience. We talk about the not fitting into clothes or feeling self-conscious about wearing clothes that expose your arms.
Yeah.
We hear that all the time, don't we?
Yeah.
Yeah.
Arms are too tight or sleeves are too tight on people's arms. They have to buy different size clothes to fit their arms, and it's really a liberating thing.
Yeah, that's cool. All right. So let's see here.
All right. So a little bit about my weight loss story. I started losing weight in April of 2024, a little bit before I joined Dr. Hamwi's practice. I lost about 185 pounds over the course of a year and a half or so. And you can see these two pictures, the left one's from February of 2024 and the right one's of September of 2023. You can really see the size of my arms, and I guess I usually try to hide them or hide myself in pictures, and I wanted to embark on a weight loss journey just for a better future for myself and to gain confidence. And I gained confidence, but I was still avoiding certain poses and photos. So you can see this one here, this was taken at a wedding, and I was super self-conscious of how much my arm...
How much do you think you had lost in that photo?
That was in May, so probably about 140 or 150 pounds.
Yeah.
So you could tell there was quite a deflation effect, but I still ended up losing a little bit more.
But, I mean, look at you. I mean, this is one of the really powerful things that we're seeing these days with people losing significant weight. Like, it used to be very uncommon that people lost 100 pounds, and now we're seeing that more. And, I mean, like, that's already a different person, right? I mean, you've shrunk in a lot of ways.
Yeah.
But I guess I see what you were starting to describe. You had certain poses that you would...
Yeah, there are certain poses where I was still kind of avoiding them in photos. That middle photo, we had lunch one day for one of my coworkers, and that photo got posted to social media, and I could just see the textural irregularities of my arm. And same thing on the right. You'll see a more zoomed up version of this in a minute, but those textural irregularities, even though I had lost the weight, still avoiding certain poses and photos.
All right, look how beautiful you look in those photos, though. I mean, this is even before any of this stuff, right?
Thank you.
And I really have to say, like, losing 180 pounds is no small feat, right? So, like, congratulations to you. I don't think we celebrate that enough. But also, this is actually a big deal, and we'll maybe get into this a little bit more. Look at the arms in that picture on the very right compared to that picture in the last slide. I mean, these aren't the same arms, right? Like, this is not this. And when it comes to surgery, I wouldn't be able to achieve, what we did with Jill, in the, in that situation versus what we have here, right? So, this is really very much a team effort, right? And I would like to actually sort of put that out to anyone who's considering a brachioplasty, that the more that you can lose on your own, perhaps the more optimal the results can be with the outcome. So, all right. So why a brachioplasty?
So I had always kind of struggled with my arms. Again, you have to buy bigger shirts and just not feeling confident in photos. It makes you look very wide. A lot of our patients say that their arms are disproportionately larger than the rest of their body. And even though I was working out, the picture on the left, I was at a Pilates class. You can still see that I was unable to kind of shrink the skin in. I had a lot of skin compared to my little arm underneath that. And even through gaining muscle, the skin wasn't able to contract on its own. So I considered a brachioplasty, but I never thought that the scar was worth the trade-off when I was researching other surgeons. And after I worked with Dr. Hamwi for so many months, I'd worked with him a little over a year when I had the brachioplasty. I had just seen patient after patient glowing about their results, and you can just where they come from and where they get to. It's amazing. And I thought in my case, the scar would be worth the trade-off. And I was really happy with how everything came out.
Well, I would have to say that's another important point that I like to make when I'm talking with patients is that, there is a real trade-off with the brachioplasty, right? There is a conspicuous scar, and you never quite know what the scar is going to look like until you get it. And I sort of have said this a million times to patients and in other talks. Different parts of the body scar differently. Faces have a tendency to scar very, very well. Breasts and bellies can kind of be middle of the road. Arms and legs sometimes have scar more poorly. The scar can be darker. It can be thicker. There are a variety of reasons for this, but in the arm, they can sometimes tend to spread. And some of that can be controlled and some of it can't. But, being, I guess, true with yourself about, is this a reasonable trade-off is an important part of, I think, the conversation that you should have with any surgeon and with yourself, okay? Because you have to love it when you're done, and it has to feel like it's a reasonable trade. So, and then you said something else that kind of stuck out to me that I hear. Actually, I had a patient once articulate this in a way that I thought was kind of captured it perfectly. And she was like, after I lost all this weight, I felt like I had, I can't remember what it was, 10-inch arms and 14-inch skin, right? Right? And I think that like is actually exactly what's going on.
Yeah, you can see it all folding over that left photo. It's all folding over on itself. So,
but you got that 10-inch arm for me, right? So I can take credit for that. All right. So let's see here. My evaluation. So these are some pictures of Jill before her procedure. Let's look at how like a plastic surgeon might look at a patient and sort of talk with them about the procedure and how they would do it and what applies in their particular situation. So I guess coming back to this idea of the 10-inch arm and the 14-inch skin, that's really what's going on with Jill. So first of all, what's going on? What do I see? Well, I see good arm shape and definition. If you look at the shadow here underneath her tricep, you can make out the shape of her arm underneath. You can almost predict, what this is going to look like when you get rid of the skin. She's got a nice sort of like even transition where the skin sort of begins to slope. It's not very I call it obtuse, where it like drops down very quickly. What's the significance of that? Well, as you need to lift less towards the elbow, you don't need the scar to quite go necessarily as far. If you have someone the skin drops down very quickly, a lot of times that patient will need a slightly longer incision in order to chase out the excess skin. But on the other side of the arm, down by the shoulder, there is more skin in this area, right? If we look at the top of the shoulder down to the bottom of the arm here, that distance is elongated. So that tells me that we can't give her an excision or a scar that ends at where the arm meets the armpit. Her scar needs to go into the armpit a little bit. And this is really common with, honestly, like most brachioplasty patients. And the way I describe this is the reason that is because of brachioplasty, the skin you're removing sort of looks like a banana. It's wide in the middle and it tapers at the end. All right? Wherever it tapers, you don't get any lift there. You get the most lift where the banana is the widest. So if I want to get lift at that point right there, my incision can't end there. It still needs to be wide. And then it tapers into the armpit. All right? What else? We've got arm has good size and structure. You can see the shoulder muscles. The skin hangs when it's extended. I don't see any banding. I see like the skin kind of like rotates around a little bit. There's, a lot of it, but it's nice and smooth on the outside. These are all good things. She's got good forearms. She's got little forearms, right? So I can shrink her upper arms without having to worry about staying in proportion. Yeah. So, and then setting expectations on the scar, the recovery, the risks. We had a conversation about that. Talked about pictures. Talked about, are you comfortable with this? How are we going to fit this into your life and your work schedule and all the people that are, may be involved in helping you heal appropriately? And we'll talk a little bit about that here in another slide. So I just like this slide. What are we seeing here? I like this analogy of a balloon. When the balloon gets stretched or expanded and it stays like that for a long time, or it's overstretched and you let the air out of it, when it comes together, it doesn't come together all the way. And it can come together a little wonky, right? So that is, because of excess volume, or it can just be aging. A lot of people, this isn't just a weight loss phenomenon. Sometimes as we age, as we age, the skin loses elasticity. And even with a minimal volume loss, that shows up even more. And you can start to get the sag and the hang and the crepiness that oftentimes shows up sort of when your arms are down towards the front and inside of your arm, right? And so, unfortunately, skin elasticity is one of these things that plastic surgery and science hasn't conquered. And the non-surgical things just aren't effective enough at removing any like real significant amount of skin. So if you need skin removed, that's 2 inches wide, it's got to be surgical. It's got to be excisional. So the plan for Jill's arms, what was the plan? Well, here we've got, this is sort of an interesting photo. We've got at our consultation back in June. So you'll notice that Jill still was bigger in this photo than she was in September. So she had planned to lose a little bit more weight. So we said, absolutely, do that first. 1, I can do a better job. 2, you're going to have a better outcome. 3, sometimes the risks can be less if we have to do less. So both for, optimal outcome and reducing risks, we always like patients to get to their sort of ideal weight or lose weight into sort of an ideal range. We discussed doing a little bit of liposuction. She didn't need a lot. She'd done most of the volume reduction on her own, but I still like to use liposuction because it allows me to sculpt a little bit. And it kind of loosens up the tissue in a way that I can typically like pull out a little bit more with less tension, which typically allows me to get like scars that don't spread as much, because scars do not like to be pulled apart. If anything, like to be pushed together. And so if you can get out more skin with less tension, that gives us an optimal scar. And then we talked about like having to remove the skin. This is not the sort of thing that I've got any lotion or potion or like laser that could achieve. And so we sort of talked about where that would go and sort of designed what that would look like. Where is the scar placement? How far does it go into your armpit? Things that we just talked about. So how might this be different for other patients? I sort of was talking about this, but this is where, if the arms are bigger, we can shrink them with liposuction. This isn't totally a fair photo because, the 1 day post-op, there's a lot of swelling here. But you can just see that like Jill had a little bit more arm definition, right? She had lost some of the weight on her own. There wasn't as much of a lift that needed to be created between like the top of the shoulder and the bottom of the armpit. When you've got a really long distance here, like that can pose a problem. There's this phenomenon in like plastic surgery as kind of a saying that the closer you start to the finish line, the easier it is to get there. So if you have something in mind, right, and you're thinking like, wow, that looks nothing like my arm. Well, what sort of things can we do to get your arm closer to what you have in your mind before doing the procedure? And then looking again for like proportionality of the forearms and the upper arm, the rest of your body. Looking for skin that continues onto the chest wall, looking for banding. Banding's a tough thing. It's one of these things that like, I don't know, banding is a transverse crease that typically develops where there's actually less fat underneath the fold. And it's, typically if you got a really deep band, you usually tell people like, don't expect that that's going to go away. And sometimes even break devices can make them a little worse. Typically not, but that's something you kind of got to watch out for. So then getting ready for your surgery. We asked Jill to lose the weight, but then we said, like, stay at that weight, all right? We don't like operating on people when they've just come off of, like, a big weight loss journey. Because typically when you're losing weight, you're nutritionally deficient, right? You are calorie deficient. You're oftentimes protein and vitamin deficient. And those things will predispose you to, like, wounds and openings and the body not gluing itself back together right. So we say lose the weight, get to your weight, stay there, all right? And that's where the nutrition comes into this. Make sure that you've got adequate protein. Make sure that if you've had bariatric surgery, you're taking your bariatric multivitamins. We typically ask for labs and clearance in patients that, in most patients, but also depending on your medical history, right? If you've got some sort of a unique medical issue, we want to know from your doctor that it's like safe to operate on you and there aren't any booby traps. We also talk about finding the help for afterwards, right? So your arms, you use them for stuff. So you need to make sure that you've got proper support for afterwards. And how does this fit into your life? If you've got a strenuous job, taking appropriate time off of work so that you heal well, you don't set yourself up for any issues. So those were all things that we sort of did with you. I think we can talk about those a little bit later, right?
Yeah.
How in your case.
Yeah.
Right, perfect. All right. So the procedure and the experience. Do you mind telling people sort of what it was like on the day of the procedure?
Yeah, so I got in the morning. We did mine on a Sunday. So I came in early in the morning. We don't typically operate on Sundays, just happened to be the day mine fell on.
Yeah.
So we came in early in the morning. I got ready in what we call the ready room. It's kind of our pre-op area. One of our assistants took my vitals. We signed consent. Did different things like that. Dr. Hamwi came in. We took some photos, did the markings. You can see the purple marker on my arms. Took the medications. We give everyone oral medications before we start. And then I was brought into the procedure room. I got all cleaned off. I washed with HIPAA the morning of, and then we washed again just to make sure that my arms were super clean. And then we started with the procedure. Very painless experience. We started with the numbing, couple pinches here and there. Pain never exceeded like a 3 out of 10. Very manageable. And I see how well patients do really well. Like it really is a breeze for people. So the numbing was very manageable. And then we went on to the liposuction. The liposuction's even easier. Than the numbing. We get to move around into different positions. We were talking, catching up on life. We don't always get to connect because we're just so busy in day to day. So good time to connect. And the brachioplasty, I think I kind of fell asleep in that part. I got a little tired, but in and out, and we were having good conversation. The procedure was incredibly painless. And then we put the Pico dressing on. Everything is so well organized. We do so many of these. It's like synchronized dance. Like everyone's kind of got their own job, and we all do them well. And everyone works together to get the job done. They did the garmenting, the Pico. I gave everyone a hug, and then went home for the afternoon.
Yeah, perfect. Yeah, and I mean, again, like Jill's case, like couldn't have gone better. I think. Because you were a smaller case, like, I mean, we're sort of in and out, pretty easy, right?
Yeah.
And then, I guess here, I've got a photo here. This is after we've done the liposuction. And so what you'll notice is that the skin here is sort of empty, right? And now I'm taking a moment sort of after the liposuction to sort of like show myself, what this is going to look like and make sure that the arms are like as symmetric as they can be. And that they have the shape that I want them to be. And I went in and I actually did like a little extra work in this shoulder to try and give us a little bit more shoulder definition. But that's sort of like what this is sort of demonstrating. And then we came through, and I'm taking a little break here, but what we did is we tacked up the skin on this side. So we haven't actually done the brachioplasty. This is just a moment of sort of like planning where I will sort of like clip up the skin to show myself what it looks like, to make sure that I'm kind of getting the shape and the design that I like.
When I'm doing procedures with you, I have to say this is one of my favorite parts. You get to see like the old arm and then
the new arm.
And it's just kind of a cool thing to look at, take a picture of it, like right. You're looking at old and new, and it's a really cool comparison.
It is. It's a pretty energizing moment. Yeah, that's cool. So anyway, this is that sort of idea of, we've got the lift on one side, and then over here, the side that isn't done. And what you'll actually notice is that like the skin almost looks like a little bit looser. That's because of the excess volume that we took out of there. And then we put on this Pico thing and send you home. And I guess this is the first day of the after the operation, right?
Yeah. So I left here around noontime, 1 o'clock, something like that. We went home. I didn't go anywhere on the way home. I had someone pick up some food for me. We really don't want patients going anywhere. I just went home and comfortably relaxed. Early afternoon is kind of when the numbing medicine wore off, but it really stayed very manageable. I was able to take narcotics that night, slept super well. Woke up probably like 3 or 4 in the morning, took another pain medicine, and drank some Gatorade, staying well hydrated. And then I came back in on post-op day 1 to see our nurse and Dr. Hamway. They just gave everything a once-over. Everything was looking great. We taped down one of the areas that the Pico kind of lifted up on,
a little bit.
And I really had no issues.
Right, perfect. So after the procedure, we typically put people in this Pico and then a compression garment. We wrap the arm in a chuck pad because you typically will drain, it's called serosanguinous fluid. It kind of looks like pink or red Gatorade from the little liposuction incisions. And so oftentimes those chuck pads need to be changed and the garments can get a little yucky. And so we have you come in the next day, 1, to make sure that everything looks the way you want it to, 2, to get that off and give you new clean, dry everything. To your point, we do ask that, like, after the procedure, people go home, you kind of put your feet up, watch some TV, order delivery, don't go out to dinner, just kind of stay in and kind of rest. And then we give you pain medicine, right? And I usually think that, like, most patients need the pain medicine for the first, few days, right? And so you were kind of taking that as needed and sort of just napping it off, right?
Yeah.
Okay, perfect. So here we are on the day after. All right. Well, so what do we see here? So the arms are lifted. We've got a little bit of, this is called strike through on the Pico. The Pico is not a drainage device. It's not designed to suck, like the drainage out, but sometimes a little bit of blood from the incision line will come through onto the dressing, and the Pico is designed actually to kind of wick it away. So it pulls it up to the surface. So see that's not a problem or a bad thing. Over here on the end of her incision, it does look like the Pico peeled up a little bit. Is that the part that they had to tape down?
Yeah, we just put another piece of tape on it. It was still working overnight, but always good to just reinforce it.
The idea of the Pico is that it is vacuum sealing the incision, and it is airtight and watertight. And so for a Pico to work effectively, it needs to have that seal. And if the tape comes up and air can get in, it's not able to hold the seal. It's not going to work, and the device is going to, turn itself off or go crazy. So one of the things that we need to do while the Pico is on is make sure that the tape isn't peeling up in a way that it's going to lose its seal. All right, so typically we then check in with patients again around 1 week, right? So tell me about 1 week. What was going on?
So the first week, I relaxed and healed. This is really a time, I was talking with my brachioplasty patient this morning, so it's kind of fresh on my mind. We're both talking about how we're very independent people. We don't like relying on other people. So it really tested my ability to, like, lean on my support team. This is kind of what we were talking about before. You have to have kind of a team of people. We don't like you lifting anything too heavy. So I needed to rely on people to drive me places, and it was a time of relying on my team, and but you're still able to take care of yourself. And I think that that's a question that I often get a lot from our patients. You're able to use the bathroom by yourself. You can brush your teeth. You can feed yourself. All those things that you're able to do. You just can't lift your arms above your head. So I had someone else help me wash my hair for the first week or so. One of our patients has also talked about getting a blowout a couple days after, which I think is kind of a genius idea.
Yeah,
you're kind of pampering yourself a few days after. So great idea on that front. Like I said, had someone else drive me for the first couple days. It was probably day 5 or so when I went back to driving by myself, short distances, kind of working my way up to my commute to work. I did take that first week off, but I think on like Thursday or Friday I went out to dinner with some friends. It's not incapacitating. I was still able to live life. I just kind of rested and relaxed, took a bunch of naps. And then for pain control, we did talk about the narcotics. I took them for probably the first 24 hours, switched to Tylenol after that, and I took that, I think, through like day 4 or 5 post-op, and then I discontinued that as well. So it was a pretty comfortable recovery.
Okay. Yeah, perfect. Usually for most patients in the first week, we're saying take it easy, avoid strenuous activity. Usually, if depending on your job, we kind of tell everyone take the first week off. If you've got a job where like you are at a desk, you're writing emails, you work from home, you might be able to go back to work after the first week. if you've got a job where it's a little bit more strenuous, you're in an office, you may want to give yourself 2 weeks off. If you've got a really strenuous job, it may even be more like 3 weeks. When it comes to self-care and stuff like that, I mean, I'll tell you, I think you talked about washing your hair was a challenge. I don't know if like everyone has that experience. That one's a little bit weird for me, but I do encourage people. I say, listen, I don't want a lot of tension in your armpit pulling like this. So we usually say 90 degrees is fine, but avoid like changing light bulbs, all right, or jumping jacks. But we do want to keep the arms moving, right? We do want to maintain our range of motion. And so sometimes doing those things is important as well, as long as you're not like pulling on the stitches in a way that's going to like create a problem. Driving, I usually tell people take a week off. You need to be off the narcotics, and you need to feel like if someone cut you off, you'd be able to like swerve, like without like being like, distracted by your arms. Time off work based on how strenuous your job is. I typically worry a little bit about like my nurses have to lift people. Sometimes like people have to stand a lot or use their arms a lot, hairstylists, things like that. And then pain control, I mean, I think you're off your pain medicine a little bit early. I usually tell people like you're going to want it for the first week, maybe it's 3-4 days, and then you start weaning off of it, something like that. I like this, like where I want this is I want it to be sore, but not like out of control. And then like if you're one of those people that sort of like needs the medicine, like take it. Could you need it for longer? Absolutely. I think that you were a little bit on the, you didn't need it as long as like most patients. Yeah. Let's see. Let's look a little bit at our arms in the picture. So what do we see? Incision sealing well. There's no openings, no like red spots that tell me that the tissue is angry. The incision line itself is everted. All right. Sometimes they call this a pie crust stitch. Surgeons call it everted edges. The idea with that is that it as the tissue heals, as incisions heal, they tend to retract and pull away, and that can add to the scar spread. So if you evert the edges a little bit, that resists that and give a smaller, thinner scar later on. So that's actually a normal expected thing. What else? She's a little swollen, right? Like if you look at her arms now versus then, she's got a little bit more definition now compared to then. That's just because of the swelling that we expect after liposuction. Not a lot of bruising. We tend not to get a lot of bruising. I guess could you get bruising? Yes. But this is kind of like what we would expect to see in that regard. The marker's still on. That hasn't gone away. That sometimes takes a little longer to go away. 2 weeks. What was 2 weeks like for you?
So on day 8 post-op, I returned to work for light duty. So instead of my normal like operating room scene, I was rooming patients, I was charting, things like that, standing on my feet for a longer period of time, but mostly desk administrative type stuff. I am also a college student, so that first week I was able to kind of work on the computer, stay up on assignments. I did it in little short spurts, like, 4 or 5 days after surgery. So answering emails for 30 minutes, working on assignments for 30 minutes, things like that. I was able to get back to driving normally. Again, shorter distances. My commute to the office is about 30 minutes or so I was able to drive to the office and then drive home. We took that Pico dressing off after the second week, so we replaced it on day 8, post-op day 7 or 8, and then I wore it throughout the second week. Resumed to normal activities again, able to work on the computer, able to kind of go back to work on light duty. I found that my forearms were a little bit tender as opposed to like my upper arms. The back of my upper arms especially were numb. I could feel sensation, but it was like a different sensation than what you can normally feel. And again, we were talking about it a couple minutes ago, just maintaining some movement so that I didn't get any stiff joints.
Yeah. So in Jill's case, we did do a second week of Pico. That's an option for patients, and patients sometimes are very interested in that. I think that once you get past the first week, like given like when we took that dressing off, it looked the way it did. Like I love the way it looked. I don't know if we like that necessarily needed that extra week of Pico, but since you're here, since it was available, it's a nice thing to have. I think the more Pico, the better. And we actually, since you were willing, allowed us to try some other sort of like scar management modalities that we'll talk about a little bit later. At week 3.
So we took the Pico off 3 weeks. So it was day 15, I think. The Pico stopped working on day 14. It was a Sunday night, and I was talking with our nurse and our marketing coordinator the day that we were the Pico shut off that night. It was kind of like an end of an era. It was a little like my suit of armor is gone. That's how our patients described it, and I think it's totally accurate. Yeah. So we switched to steri strips along the incision, some minor OR procedures, so like upper eyelids, little things, not our big liposuction cases, but still a mix of like desk work, charting, rooming patients, things like that. Comfort was improving. I think pretty much all of my forearm soreness and my soreness in general was gone by this point. And a lot of patients asked me about this. So again, we included it. First time I was able to comfortably lay on my side. It was more like getting up onto my side that was a little sore. Once you're on your side, it's fairly comfortable, but the moving around and trying to use your arms to reposition you, slight uncomfortableness, but 3 weeks was kind of the first time I was able to do that.
Right. Oh, perfect. Let's look at our arms. So they look great. We still have that sort of eversion thing. The incision itself is, it doesn't look like a scar yet. It still looks like a incision that's been sutured together, right? And that's kind of what we would expect. The marker is finally gone. There's no, red spots that look particularly irritated. Good shape, still swollen, but like the swelling is starting to go away. It looks different than the way it did at week 1, right? But yeah, that looks great. All right, so then we did 4 weeks.
4 weeks, we were all done with the steri strips, started incorporating some scar therapy treatments. We'll talk about that, like he said, in a couple slides. Started to get back to normal. Again, hanging out with friends, going out to dinner. Really, I tried not to let it limit me too much. That's my next bullet point. It's easy to forget that it was like you're still healing. I was trying to get back to like lifting, or it felt like I could get back to lifting heavy stuff, but we try not to do that. So leaning on your support people, leaning on my coworkers to help me with different things, trying not to like restock our rooms and stuff like that, carrying heavy bags, relying on family, friends, coworkers, and my pain was all gone at this point. So.
Yeah. So, I like to think of the recovery as sort of having like 2 phases. There's the like immediate postoperative part, which is the first like 3 weeks, where I think like the incision kind of looks a little bit like a fresh cut, whereas the second 3 weeks is starting to look like a scar. I think the first 3 weeks is when it's tender and sore and sort of like on the front of your mind. By the second 3 weeks, you're forgetting my name a little bit more. And yeah, but you do actually, I tell people that like, just because the like pain is going away and it's not feeling as uncomfortable, you still need to protect the incisions. Like it's still fragile, and how it heals during this period affects what the final scar will look like. So, I think that like in terms of like, people often ask about openings and infections and things like that. I think that like if you're going to have an issue, like those like post-operative things typically happen in the first 3 weeks. Once you get to kind of 4 weeks and on, now it's more about just like not, doing anything that's going to jeopardize the final results. Keeping it clean is maybe another big thing worth kind of talking about, is that wash it regularly, because, before you were keeping a really close eye on it, you still need to. Week 5.
So this is when we started, again, no pain at this point, started working with different scar therapies. I think on the next slide, it'll show a picture of what the actual bridgets look like. We used these, kind of pushed the incision together. My patient this morning was kind of asking about them. I think that the bridgets worked well. They weren't uncomfortable. But we kind of talk about like their effectiveness as far as how long they stayed on. They were popping off kind of at inconvenient times, if you will.
Let me explain what a bridget is.
Right.
So, we were talking about how incisions don't like to be pulled apart, right? So if you put this bridget on, what it is a little plastic clip that has a sticker on either end, and you put it on, and then it kind of pulls the skin together, all right? And so you get a box of them, and you clip, all the way down. And when you look at it, there's, I don't know, like 30 bridgets on your arm, right? And what you were saying was that, like, they fall off.
Yeah.
Right?
So one side would lose its adhesiveness. So it'd be holding on just by one side. And then I was worried it was going to rip it off, open up the incision. So there was a little bit more hand holding that week, and I was a little bit more cautious about what I was doing. And I'd find them everywhere when I was getting dressed and stuff like that. So just being extra cautious about what I was wearing.
There were a lot of them.
Yes, there were.
And I guess they can get like caught on your clothes and stuff like that. But I love these like little adjuncts, and I'm always looking for ways to sort of improve the procedure. So if you're someone that like wants to include this in your recovery, I'm like totally okay with that, and actually encourage it. I think we talked with the rep, and they were saying that a lot of times, like, they'll put on like immediately post-operatively, and that for that first week, I think I would prefer the Pico over the Bridgets, because that does some things actually stimulate healing in the tissue, where Bridgets are really more for like tension offloading. But then we also tried this thing called the Embrace. Do we have a picture of that? Embrace is essentially silicone sheeting, but it's applied. It comes in a package, and the silicone sheeting has been stretched, and so you put it on, and you pull this tab, and then the silicone pulls itself together. And so you kind of get the benefit of silicone sheeting, which has been shown in a variety of literature to be particularly good for improving scar appearance. Plus the tension offloading. And I think like we kind of like that, right?
Yeah, the Embrace was great.
Yeah. You got to make sure you keep it clean. It goes on, it stays on for a week. So again, you got to make sure that you don't have anything kind of brewing underneath there. It's clear, so you can kind of keep an eye on things. But we usually wait until you get a little bit further before we put that on for exactly that reason. You don't want to like cover a cut with silicone sheeting, because you worry that like bacteria can, be underneath there and proliferate. So I think we waited, a little bit to do that with you. Week 6. Sorry, we got the Bridgets off. What week 6?
So at this point, I was cleared to go back to normal activities. I am able to go back to the gym at 6 weeks post-op. We'll kind of talk about my getting back into the gym, but for those first couple weeks post-op, I really stuck to like cardio and legs, and then light weights on the arms. I was back in the operating room at this point, and the OR requires it's strenuous on the arms, so I didn't want to be sore in my arms when I was trying to do my job, so got back to it by lightly lifting some weights, trying to build my strength back up, because I hadn't used my arms strenuously for a couple weeks. And then I was trying to work back to full range of motion. So at that time I was able to lift my arms above my head, but it was a little bit sore in the armpits. We didn't want anything to open or cause any issues, scar spread, anything like that. So slowly working on getting back to like reaching that thing on the top shelf.
Yeah. If we look at our arms, swelling is, starting to go away a little bit even more. We've got a little bit of a pink scar developing, right? So now again, it looks less like a cut and more like a scar. You'll notice that there are still some little dimples or pinch marks from the sutures underneath. And that actually is from the stitches that we put. Those are gone now, but even at 6 weeks, when we usually say, all right, go live your life, there's usually a series of little dimples from those stitches that haven't dissolved yet. And that's actually a little bit intentional. But, do you mind if I kind of put your arm up? You'll notice at this point, it's nice and smooth. And it's starting to turn pink, which is actually another thing worth talking about, is that like scars tend to have this process where they get they start out looking like a little line, they get a little pink, and then they start to fade. But that process takes months, not weeks. and we'll sort of touch back on that. And you're sort of right in the middle of that right now. We'll have to probably do an update to this when you're a year out and it's had time to fade. But all right, here we are. It was a post-recovery, working out. Let's talk a little bit about working out. What did you do?
After 6 weeks, I waited another month or so before I actually went back to heavy stretching things. So here I am on the Pilates reformer. My coworker took this. My coworker and I are little Pilates friends.
Buddies, yeah.
So we go to Pilates together, and she took this as a memorabilia, going back to Pilates for the first time. But in Pilates, you really stretch your arms out to the side. And I think that's one of the first times that I had really been okay, I really want to do a brachioplasty. There was this video that I go to Body Bar in Lakewood Ranch. They posted to their social media, and we were doing this exercise where you stretch your arms out to the side, and they caught this video, and all I could see was the bat wings, or that's what the patient's calling it. The excess skin that was hanging down when we were extending our arms out to the side. And on the right side of the picture, that's a mirror. So you sit facing the mirror and you do all these exercises facing the mirror. And so all I could see every time I was going back to Pilates was the excess skin on my arms. So it was liberating to go back to Pilates for the first time. But again, a lot of stretch. So we kind of waited, protected the scar a little bit longer. And every time I go and work out, I wear Mepatech silicone scar tape. So it's skin colored. I wear it right along the incision, one piece going like this, and then one piece down in the armpit, just over the entire incision, trying to take the tension off the incision and make sure that it doesn't spread any.
Boom, that's perfect. Yeah, so the idea behind that is that if you put that scar tape on, that if you get a pull, it pulls, the scar itself has sort of been secured underneath the scar tape, and so the skin will shift without pulling on the scar. 3 months for Pilates. Yeah, we usually tell people that they can go back to the gym at 6 weeks. I think we waited 8 for you just to be careful because I know that you are active in the gym.
Yeah.
But Pilates was different because of the stretching, the fact that you do a lot more stretching with that. So anyway, oh my God, look how amazing you look. I just look so happy.
I got my little arms.
Yeah, well, I know, but you're just how cool. All right. So here we are. We're just kind of do a little walk through the scars as they were modeled. So, all right, so we had that last picture at 6 weeks, right? It was a little pink. Now here at 11 weeks, it's sort of more pink. We still have those little bunchy little pucker things where the sutures are in some places. 13 weeks. Same thing. I don't think this has actually changed much. I think if anything, it's just maybe the lighting. But swelling going away, lifted arm. 15 weeks, 17 weeks, 21 weeks. Where are we now?
21 weeks.
21 weeks.
This we took that yesterday.
Do you mind if I put your arms up real quick?
Sure.
All right. So when we look at Jill's arms, we'll notice that this one's a little bit pinker in the scar itself. This one's got a little bit more of a pink perimeter. Both of that I expect will go away with time. We've got a little bit of a scar spread right there. I would recommend silicone massage, silicone tape, all those things. But that's going to continue to do, it goes through this process called remodeling. And again, we'll have to check in months. All right. But I usually expect that scars can stay pink, and actually get more pink in the first 3 to 6 months. So sort of be ready for that. Hopefully it doesn't happen, but that's definitely a common thing. And in most cases, it gets lighter with time. In some cases, it doesn't though, right? So this is where, being, I guess, honest with yourself about, is it okay if I have a scar that isn't, invisible? Am I still going to feel really good about this? And then, how are you looking till now? Look at it. Oh my gosh, I love this.
So we went through most of my camera roll and just kind of found things. I'm mostly wearing sleeveless things now, and that's the beauty of living in Florida. So I've picked out these scrub tops. You can see in this photo here. This is my coworker, Jenna. These are the scrub tops that I used to wear. So you can see, and Rachel too. They're wearing short sleeves, so they cover most of the arms. I actually prefer now to wear these that are like a little more sleeveless, show off my new arms. And patients ask about my arms all the time. They kind of know through Jill's journey that I've had something done. So it's the easiest way to say, look at what I've had. But it brings me great joy to wear something that's a little bit more sleeveless. Same thing, I'm here at the beach. You can see the little end of the scar here, but I mean, it's mostly covered, and you can just, my arm stands out, right? It looks like normal anatomic arm, and that's something that I didn't have for so many years. So my arm is front and center in this photo, so I thought that it was kind of a great way to show off that, like, I'm totally comfortable with that now. Same thing, we're wearing sleeveless here. My forearm matches my upper arm. I really love wearing short sleeves and sleeveless things now.
Jill, I love this for you. This is like, I mean, this is the stuff that, this is why we do this, right?
Yeah.
So, oh gosh, it just, I'm getting the feels. All right. So let's talk other considerations. Okay, just in general. So, if you're someone that's considering a brachioplasty, your medications, right? What are some of the ones that we're looking out for? Anticoagulants, aspirin, heparin, Lovenox, Eliquis. Those are things that you either need to stop for various amounts of time before surgery. Typically, it's 2 weeks for aspirin. That's the one that has the longest half-life. It's actually an irreversible platelet inhibitor, so your body has to build new platelets. It's not just the medication needs to wear off. Immunomodulators. We're seeing a lot more of this these days. So a lot of the immunomodulators for like rheumatoid arthritis and a variety of conditions actually decrease your body's ability to fight infection, and some of them actually change the way that your body kind of glues itself back together. So some of those need to be held for anywhere from a week, 2 weeks, some of them like 5 weeks, some of them even a couple of months. So going over your medications preoperatively, having a conversation with your surgeon and the other people that are involved in your healthcare, if you've got medical issues, is an important component. Then there's some other medications, SSRIs. Don't mix with like narcotics, and particularly like tramadol. There are some medications that just have reactions if you mix them that you don't want. We talk about nutrition. Good nutrition is super important because your body is burning through calories and protein, both macro and micronutrients, in order to glue itself back together. And so it is well documented that people with poor nutrition have like poorer outcomes and are more prone to like openings. And, you know, people who have like wounds, if you go to a wound care clinic, one of the first things they do is they look at a patient's, their nutrition and try and increase sometimes the calories and the protein that they're getting. Range of motion, one, like both preoperatively, operatively, and postoperatively is a consideration. In order to do this procedure and to do it awake, you need to have your arms out, all right? You need to be able to sort of put your hands behind your head and put your elbows on the table and keep your arms out so that we can do the surgery. And if you have issues with range of motion, not that you have a brachioplasty, but like, you know, maybe my brachioplasty isn't the one for you, or maybe there are things that you can do to sort of like help you get better range of motion before the procedure. But if you have issues with range of motion, shoulder replacements, things like that, that's the sort of thing that we need to have that conversation before the procedure. The size of the arms preoperatively affects the results. We talked about, like, I was able to give Jill something that I'm really proud of and that I think is really special, but like, because she had lost so much weight, right? She lost 185 pounds. And then on top of that, I guess this was part of that 185 pounds. When we started talking about brachioplasties, we said, all right, if you want to shrink, do it beforehand. We also don't love, doing a brachioplasty and then someone losing weight afterwards, because that deflation effect kind of comes back. So lose the weight before the procedure. Size of forearms affects, how small we can make the arm. You don't want to create like this what Popeye arm sort of effect. And so having smaller forearms allows us to make small upper arms. Let's see. So let's see, other things. Extended versus traditional brachioplasties. So what is a traditional brachioplasty? A traditional brachioplasty, it typically has a skin that's resected from the inner elbow, typically to the armpit or a little bit into the armpit, where an extended brachioplasty typically comes down and kind of wraps underneath the breast. All right. Now, with my brachioplasties and the patients that I see, I'm typically needing my design to go into the armpit a little bit. I don't necessarily need to go all the way down the chest wall. That's something different. But in order to get that lift in the armpit, sometimes I will extend into the armpit a little bit. Now, I do that so that I can get good lift in the arm where the arm meets the armpit. But it isn't specifically to address loose skin on the side of the chest. All right? So if you've got a lot of extra loose skin on the side of the chest, sometimes it's a good idea to continue that down and take out a little bit of skin from the side of the chest wall as well. And that is considered an extended brachioplasty. Let's see what else. Revisions. If you're someone that's had a brachioplasty and you're like, I didn't quite get what I wanted, and this is the sort of thing that like Dr. Hamwi could, polish this up a little bit, we'll look at your arms and we'll say, one, is there enough skin to take anymore, right? Like, is this the sort of thing that like another brachioplasty is a reasonable thing to do? Because if you've got like tight skin and you're young and you've got like some good elasticity, but the scar, is thicker than you want, if we cut out the scar, are we going to be able to get that closed, or is that going to be under tension again, which may have been the reason that the scar was wider in the first place? In that regard, will this happen again? Revisions are definitely possible if you've had a brachioplasty, but we all need to sort of figure out what you didn't like about the first go round and if it's the sort of thing that we can improve. Mini arm lifts. I'll tell you, I am not a huge fan of a mini arm lift. Mini arm lifts are crescent excisions from the armpit itself. It's typically a transverse incision and scar. So in theory, it may look really nice to have a scar that doesn't go down your forearm. The problem with them is they're very limited in how much skin you can actually excise, and they tend to create extra tension that when you lift your arm up can pull the skin funny. So I don't know, I just Googled like mini arm lift for an example, and this is, I guess, the before and this is the after. And, what you'll see here is kind of what I'm describing here. You've got that transverse scar that's in the armpit. That's great. But it's kind of pulled the skin a little bit funny. And I'm not so sure that, you just don't see the result, translating down the arm. It may pull the skin in this area, but it's really not doing anything down a little bit more distally, towards the elbow. So usually what I tell people is wherever there's loose skin, that's where you need the incision to go. So if you've got loose skin down at the second half of your arm, well, you need the incision to go there. Sometimes we do get away with mini arm lifts, but the scar still goes in this direction. It's if you just had a little bit of skin right there, maybe we can just excise that, but you're only going to get the result where the scar is, where the incision is. All right. Other things, out-of-town patients, how long to say? So, patients usually fly into Sarasota the night before. They get settled. We meet on the day of the operation. We kind of design everything together. We do the operation. You go back to the hotel or wherever you're staying with your companion. You come back to see us the next day. At that point, we have the Pico on. So there's not much to see or do, and it stays on for a week. So if you're living in an environment where we can send you home safely and you've got access to an ER or wound care clinic or medical care, God forbid you had an issue, well then I guess I'm comfortable with letting you go home. If you need to stick around or would like to stick around so that I can see you, we have you come back a week later so that we can take the Pico off and change it and see what's going on underneath there, and then would then get you sort of into our normal post-operative follow-up schedule, which usually is a 1-week follow-up, a 2-week follow-up, 4-week, a 6-week. But really, I mean, that is variable in whatever you want and whatever you need. It was quite, it's customized to like your healing and your comfort level. Traveling into Sarasota. I think the Sarasota airport is like a lovely airport. It's kind of like a small regional airport, but it's convenient. It's easy to get in and out of. I definitely recommend if you're coming into Sarasota, flying into Sarasota as opposed to Tampa. Tampa's the bigger airport. It's about an hour away, but it really does feel like a whole sort of city away, right? Yeah. So anyway, other questions? Anyone have anything that they want to touch on right now? By the way, Jill, I care about you. I'm just doing this with you is really I don't know. Thank you.
Thank you.
Yeah, absolutely. Yeah, let's see. I'm going to scroll through here and see if there's any questions. Please feel free to write in if you want me to talk about anything in particular. Is the lipo necessary in most cases? I would say usually. So, I mean, if you look at Jill's picture beforehand, you'd say, well, that isn't a patient that necessarily needs lipo. But because I was able to do that, I was able to, like I say, get out a little bit more skin. By evacuating the fat before I took the skin out, the skin actually becomes a little bit more pliable, and there's a little less tension because we've done this volume reduction. So I tend to do lipo on most patients. It also is part of like how I numb you up. I put in numbing medicine. Well, I need to kind of get that out, or else I've made your arms bigger. So yeah, there's this. I usually numb lipobrachioplasty, but the extent of the liposuction is largely dependent on how much fat you have. And I think that the less liposuction you need, the easier the recovery. Maybe that's why it was like a little easier for you. It's just that you didn't need as much lipo. Yeah. As far as the anesthesia is concerned, it's called local tumescent. We use a mixture of lidocaine, bicarb epinephrine, and that is kind of like a local or regional anesthesia. It knocks out the pain receptors in that area. So you still would feel like pressure and vibration, but the idea is that the pinches shouldn't be that bad. We typically say on a scale of 1 to 10, it should be about a 3 out of 10. And as the liposuction, as the numbing medicine goes in, you'll notice that that's getting easier and easier and easier. So by the time we do the liposuction, it should really just feel like vibration and pressure. And God forbid you did need like a little extra numbing medicine, we would just like give you a little extra numbing medicine. So, how long do I wear compression? So compression, a lot of patients ask about compression because surgeons feel a variety of different ways. Like, compression is good because it reduces swelling, and swelling is one of the things that sort of slows down healing. But too much compression can actually jeopardize your results. So we use compression on a case-by-case basis. I like compression, and at this point in my practice, I'm using compression on everyone, but they're not necessarily wearing it for the entire time. Jill didn't get very swollen, so we ditched the compression earlier on you because you just didn't need it. Where someone who gets a little bit more swollen, we might wear the compression longer. But we do want to make sure that the compression isn't causing any problems. It's not rubbing on the incision and creating irritation. It's not digging into creases and leaving indentations. So these are all things that, like, when you're following up at your post-op visits, that we're like checking on and deciding whether or not we want to continue the compression. Massages. Massages are typically recommended for liposuction, but I'll tell you, I don't necessarily love them with brachioplasties. The problem with massages is that when you're massaging the skin, you're sort of dragging the skin around. And in regards to like talking about how scars don't like to be pulled apart, like if you're massaging and like pulling on the incision or pulling on that suture line, I think that's going to like likely predispose you to like a worse scar. So, I think if you were to sort of like localize the massage to maybe the outside of the arm or something like that, stay away from the incision line, you'll probably be okay. But I don't typically recommend lymphatic massages when I'm doing brachioplasties. We want to lose 20 pounds. Yeah, lose the 20 pounds. Do it. Not only lose the 20 pounds, like lose the 20 pounds and then live there for like a month, or 6 weeks. Like we described with Jill, it's going to be a better outcome.
So asking how far in advance would you do a consult? You can do a consult at any time.
Yeah, I think like in terms of timing, I think that in the age of the GLP-1 like medications, I would say that if you're going to use them, do that and get a sense of what your trajectory is. We can do consults now, but if you're like planning on losing like a significant amount of weight and you're thinking like, well, this could be 6 months before, I reach my goal weight, I guess we could have the conversation now, but I would wait to get a little bit closer because your arms at 60 pounds heavier than you're going to end up are not going to look anything like they do after you lose the weight. So like I won't even be able to like accurately predict like what things would really like kind of look like once you lost the weight. Drains. I typically don't use drains. We intentionally leave some of the liposuction incisions, which are about the size of like half a grain of rice, open so that you can drain the first day. And then by the next day, in most cases, the drainage is stopped. And then you don't need the drain. So, what do we got?
So we have a couple of questions that patients submitted before. So the first question is, what's one piece of advice you'd give to someone considering an awake arm lift? And one of the things that I always tell my patients who come in for consultations who are asking like why I decided to do it, like I said before, I noticed when I was doing Pilates and things where my arms were stretched out, you can see the lax skin, and the real deciding factor for me, I drew a line on my arms, which is something that we had heard about from a patient. Take like a red or an orange Sharpie and draw a line along your arm and see how much you notice it. So I think I wore it for a couple days. Sharpie takes a couple days to wear off or to wash off. So I wore it for a couple days. I didn't really notice it much, and I would much rather, I know that my incision's a little bit pink and we kind of anticipated that. My incision I'd much prefer that over what I had before, the loose hanging skin. When I go to shake someone's hand, maybe you can see a little bit of it by the elbow, but when my arms relax down by my side, really in totality, you can't see the scar very often. So that's kind of what I did. I saw how much I would notice the scar. The answer was not often, so I decided to proceed with the procedure.
That's great. That's great. Well, thank you so much. I hope this was informational for people, and this really is like kind of a passion for me, and I love helping people, that's really the passion there. And this just seems to be a way that like we can do that. And so if this is something you're interested in finding out more about or want to talk, specifically about your arms, please feel free to reach out to us, and we can do a consultation. Typically we do virtual or in-person consultations. We've got surgery coordinators that like can talk about like quotes and timing and stuff like that. And then once you have decided this is something that you want to do and it looks like something that would be a good fit for you, then we've got like a whole clinical team that helps coordinate the process. So anyway, thank you so much. Please feel free to reach out to us. FloridaPlasticSurgery.com is,